MRI, magnetic resonance imaging. Our body is made of hydrogen nuclei which spin and wobble. That is precision at Lemore frequency. A magnetic field has a strong magnet which synchronizes the spin of the hydrogen ions and causes longitudinal magnetization. Then a radio frequency pulse is applied, which forces proton to change its alignment to 90 degrees, which is called transverse magnetization. Then the radio frequency is switched off and energy is released, and this realignment process creates an MRI image. A T1, a T2 is an image which is time to dephase 37% of transverse magnetization when the radio frequency is switched off. A T1 is time taken to 63 of proton to achieve longitudinal magnetization under radio frequency pulse. A T2 has long TR and TE. A T1 has short TR and TE. TE is echo time for signal acquisition recording. TR is the rate of application of radio frequency pulse. T1 is good for anatomy, for bone marrow, meniscus, and gadolinium contrast used in T1. T2 is better for water, is hyperintense, show pathology. Most pathologies have high water content, so there will be T2 positive. Regarding the tissue, fat is bright in T1 and T2. Bone cortex is dark in T1 and T2. Muscle is gray in T1 and T2. Tendon and ligaments are dark in T1 and T2. Fibrocartilage is also dark in T1 and T2. Hyaline cartilage is gray in T1 and T2. Stir images, short tau inversion recovery. These are T1 images with fat suppression. They are sensitive to abnormal fluids, for example, tumor and trauma. PD, proton density images. They are good for imaging meniscus. Mars, fast spin CT. Fast spin Mars. Metal artifact reducing sequence, better for the artifacts, avoiding artifacts like steel and titanium. Then contrast can be used, added together in MRI. When contrast is gadolinium in MRI, and it enhances adhematous tissue on T1. Risk of nephrogenic fibrosis in patient with stage 4 CKD. Do not administer if eGFR is less than 30. Contraindication of contrast can be pregnancy, kidney disease, and previous sensitivity to contrast media. Advantages: excellent soft tissue contrast, good for tumors, occult fractures, and no ionizing radiation is used. Disadvantages: claustrophobia, not as good as CT for bone, cortical bone, cost is the issue, and slow image acquisition time. Contraindications are pacemaker and defibrillators, cochlear implant and internal hearing aids, implanted nerve stimulators, metal objects in eye, intracranial clips, and mechanical heart valves.